How AI can make healthcare human. On November 30th, 2022, an event took place that would shake the tech world to its core: the release of ChatGPT. Looking back on that date in a few years, it will be clear that the world changed. We unleashed something that will eventually outgrow, outsmart, and may even outlive us. AI is set to disrupt many aspects of our lives, not least of which is healthcare. While many scientists and experts express caution or outright fear, most experts remain optimistic about where we are heading. You're watching Talk Tech Healthcare, where we talk top trends and next moves in health tech. Concerns about AI are already being echoed in the tech and academic communities. Tristan Harris, director of the Center for Humane Technology, warns that AI could potentially affect 80% of the U.S. workforce if there is an arms race with the technology. We hear a great deal about offshore job movement, even among knowledge-based workers. But this is different. We are close to having the ability to outsource even knowledge-heavy tasks to artificial intelligence. Swift implementation without adequate regulation could destabilize societies and lead to mass unemployment and civil unrest. These fears have led to the temporary ban of ChatGPT by countries like China, Russia, and unexpectedly, Italy. Figures like Elon Musk and Max Tegmark, a physicist and professor at MIT, have called for a pause on AI development to reevaluate the risks and benefits. Perhaps most frightening, Yuval Noah Harari, a historian of the human species, believes that AI has hacked the operating system of human civilization and questions whether we can survive it. These concerns ensure that we need watchdogs to push for regulation and responsible use of such powerful technology. However, it's important to remember that groundbreaking technologies often include fear initially. With time, regulatory bodies will catch up and adapt. AI is no different. Legal and ethical frameworks will evolve, guiding the responsible application of AI. Top researchers and practitioners are already pushing for common-sense regulation, knowing that if they don't, heavy-handed regulation will likely be forced upon them. Regulatory bodies like the FDA in the United States have already started to regulate AI-based medical technologies, with over 500 such systems listed in their official database. Even medical associations have begun issuing guidelines for using AI. Medical societies project a systemic shortfall of 10 million healthcare workers by 2030. But AI can be a game changer in mitigating this issue. There simply aren't enough human healthcare workers to go around. But AI can be a massive force multiplier, especially in rural or hard-to-reach areas. It can also amplify the efforts of individual healthcare workers by automating routine tasks, aiding in diagnostics, and providing seamless virtual care experiences. The demand for AI-enabled healthcare services is set to skyrocket as people embrace virtual consultations and digital health tools. The pandemic has already propelled the rise of telemedicine, and AI can help fill the gap in access to healthcare. If the pandemic taught us anything, it's that telemedicine and virtual technologies are needed now more than ever. Over the course of the pandemic, the US alone experienced an excess death rate of 2%, meaning that there were 2% more deaths than would have normally occurred, and which couldn't be attributed to COVID-19. People sheltered in place and deferred their healthcare needs. Over the 3-year time period, natural exacerbations occurred that couldn't be treated normally. Now, after the public health emergency is officially over, more than 300,000 healthcare workers have left their jobs for good, citing burnout and overwork. If AI can assist those whose job it is to care for us, then perhaps we can put the humanity back into healthcare. AI has the potential to facilitate doctor-patient communication, offer personalized healthcare advice, predict health risks, improve early disease diagnosis, and aid in developing precision treatment plans for individual patients. For example, an AI algorithm developed by Stanford University can detect skin cancer as accurately as dermatologists by analyzing images of skin lesions. A cutting-edge AI system developed at Johns Hopkins University can peer deep into a patient's health record, compare the patients to those with similar comorbidities, and suggest optimal treatment pathways that led to better outcomes for other patients like them. AI can predict cardiovascular diseases using a combination of labs and imaging tests, and assess an individual's cancer risk using radiology reports. In drug development, companies like in silico medicine are using AI and machine learning to predict potential drugs, significantly shortening the drug development timeline. AI will aid, not replace, healthcare professionals. It will augment our human ability to create a more robust and responsive healthcare system. We can't talk about human-centric healthcare without mentioning medical bias. The New England Journal of Medicine notes that our individual biases operate within larger social structures, whose bias can perpetuate systemic racism, sexism, and other forms of discrimination within the practice of medicine. In medicine, bias-driven discriminatory practices don't only negatively impact patient care, they also harm medical education, limit the diversity of the healthcare workforce, and can lead to inequitable distribution of research funding. AI may not be perfect, but we need to be clear about where humans fall short, too. AI systems based purely on biological pathways are more likely to treat patients equitably, assuming they weren't biased in their training to begin with. While caution and responsible regulation are necessary, we must harness the power of AI to create better health for all. With explainable AI, physicians can understand the technology without needing to get into programming minutiae. Peer-reviewed studies and clinical trials back the claims of AI-based technologies. The proof is in the pudding. The release of ChatGPT represents a milestone, allowing millions of physicians and patients to explore AI in medicine. Those of us in the healthcare field should demand regulation and oversight, while also embracing the power of AI to create resilient healthcare systems. This is why I am so optimistic about the future of AI in healthcare, and you should be too. Subscribe and like for more AI and healthcare content. You're watching Tech Talk Healthcare, where healthcare talks AI.